Hi, so as you possibly are aware, I'm Dr. Rohit and welcome to my website. I've been asked quite a few times last few days, why did I finally get on with my website? The reason for that primarily is that I've been practicing for around 10-12 years now, and I've seen that patients, while they understand what I'm trying to say, uh, they would like some sort of a material to go back to once they've reached back to their houses to reconfirm whatever I told them, the pattern of treatment, how is it going to work out for them. So many times going through the websites of different people or different companies might confuse them. So that's why I thought that maybe my own website with material written by me or collected from sources which I feel are reliable at one place can help some of my couples to actually structure their treatment and then therefore go ahead with their treatment. So this is why the website has been gotten ready. Here I must mention my good friend Moa Kichu. In 2006, both of us got together and shot a very informal sort of a video on test tube baby, because those days people were very much interested. It was a new thing as well for the UGC channel. And then in 2011 he put up the same video on the YouTube when it was just about getting popular those days. And believe me, today that is the largest, the most maximum viewed video on test tube baby all across the world. This is the power of internet, the power of YouTube. You can actually get your message across and the information across in such a beautiful way, which was not even possible and not even thought of 10 years back. Now, what I have done in my videos today and across the next 1 month is shot all the videos that were posed to me as questions by my patients, by my readers, people who send me emails, and those questions have been addressed by me in short videos. Please go through them. This will give you a fair idea about how the IVF process goes, how it works, what are the successes, what are the do's and what are the don'ts. And at the end of it, and if you have the patience to go through them, you will be much more informed, much more prepared for your own IVF cycle. Happy viewing and happy browsing. What causes infertility? Before that, let's understand what infertility is all about. About 15% couples, once they have gotten married and are actually trying for a child, find it difficult to have a child. What is the definition of infertility? If a couple has been trying for a child and they are having regular, unprotected sex for more than a year and still there is no pregnancy, that's when we call that the couple has infertility issues. By regular, I mean at least twice or thrice a week, and by unprotected, of course, you mean there is no condoms or no barrier methods that are being used. The lady is not on any sort of a contraception. She's not taking any oral contraceptive pills, which is when we say that the lady or the man, the couple is suffering from infertility. In today's scenario, this is about 1 in 6 couples that are suffering from infertility. The reason could be any of the 5 reasons, as I keep saying in my videos, and also in the matter that we have in the website. The egg quality may be bad, the sperms may not be there, the tubes may be blocked, the uterus may not be healthy, and finally the sex may not be happening properly. So these are the 5 reasons why infertility happens. It could be a single reason or a combination of these reasons why people fail to conceive or give birth. Poor sperm quality is a major reason for infertility these days. As we mentioned, 1 in 6 couples find it difficult to get a pregnancy, and I would say 50% of such couples have a direct or an indirect reason that the sperm quality is not good. What do you mean by sperm quality? What is it? Now we have to understand that sperms are the germ cells that are produced by the man. These are produced in plenty of numbers by the testes. About 100 million sperms are produced every day, and they take around 2 months time to mature inside the testes. Then they come out through a pipe that comes out of the testes and travel through that pipe for another, let's say, a couple of weeks, and then they're stored, and then when there's ejaculation that happens, the semen containing the sperms come out. Now the sperms that come out in a single ejaculate, they could be anywhere between 30 million to 300 million. But we say a good sample is where at least 40 million or more sperms are present. WHO, that is the World Health Organization, has looked at the semen sample and has given us a classification, or let's say a standard semanalysis situation, where it's expected that the semen volume should at least be 1.5 ml. It should contain at least around 40 million sperms. Almost half of these sperms should be motile. By motile, they should be able to swim from point A to point B. and at least 4% of these sperms should look healthy in the microscope. So that is broadly the definition of a good semen sample. Now, unfortunately, almost 50% of couples who are not getting pregnant are not doing so because of the lack of good quality sperms. Now, that good quality could be of three kinds. You could have less sperms, meaning there are sperms less than 40 million per ejaculate. The sperms may be adequate in number, but they could be non-motile, that is, they're not swimming in adequate numbers, so they cannot swim all the way from the vagina to the tube, that is where the egg is settled. Or they could not be looking good, or they're functionally not healthy. So accordingly, oligospermia is where you have less number of sperms, less than 40 million per ejaculate. Asthenospermia is when the sperms are non-motile, they cannot swim from point A to point B, or less number of motile sperms. And teratozoospermia is where the sperms are defective looking. They don't look healthy and maybe functionally that they're not healthy. So you could have either a oligospermia or a asthenospermia or a teratospermia or a combination of any of these. All of these constitute what we can say is poor sperm quality. Now the next question is how many people are affected and which age group is affected the most. So quite obviously, this is the age group that is trying for a child. This is the age group that is actually getting a semen analysis done. So the data that we have is only for that age group. Now 50% of men who are trying for a child and not getting pregnant have this problem. So if you were to put a figure to this, this would be anywhere between 7 to 10% men at any given time have poor quality sperms. And that is a major cause of infertility these days. That's a wonderful question. What are the signs and symptoms of poor sperm? Unfortunately, there are no signs and symptoms as such which you can look at and then predict that the person would have poor sperm quality. And that's the biggest problem. Anybody amongst us could have a poor sperm quality, and that's only coming out when we actually ask for a semen analysis test. Some of us, quite obviously, may have some very unique problems such as hormonal issues, very high thyroid, very high blood sugar levels, very obese. So these kind of people, yes, we can suspect or we can predict that they could have poor sperm quality. But by and large, anybody who is completely normal and goes for a semen analysis might turn out with a poor sperm parameter. So which is why it's very difficult to predict from looking at a person whether sperm quality is bad. There are certain indicators. You can look at when we do a physical examination, if you find that the testicular sizes are very big or very small, or when the hair distribution in the body is not optimum, it's very less, or there's very obvious signs of fat deposition in the body, we might suspect that that person might end up with poor sperm quality when he goes for a semen analysis. But as such, there are no definite signs or symptoms to be really looked at. One point I would like to mention is many times the men, when they are told that the report is not good and the sperm quality is not so good, they come back and they tell us that, but we don't have any problem in sex. Now please understand, sex is a function of the penis, which is completely different from the testes which makes these sperms. So although they may be located close to each other, the functions for both the penis and the testes are completely different. So you could have a proper sexual life in spite of the fact that your sperm quality is not healthy, or vice versa. You could have bad sperms, good sex life, or good sperms and bad sex life. So that really doesn't affect or it doesn't predict whether you'll have poor sperms or not. Sperm quality is a very difficult thing to measure. We use a semen analysis report to measure the sperm quality, as we mentioned in a previous video. Semen analysis tells us whether the count is okay, whether the motility is fine, or whether the looks are fine or not. But as such, the quality of the sperm is judged when it is able to fertilize a human egg and form an embryo. That is something that can never be judged in the lab. That only happens in real life when the person has his wife conceiving through him. Now, by and large, the question that's asked by couples is, are there medications or they can do something to improve their sperm quality? Unfortunately, very little is understood about how the sperms are manufactured in the human system. And therefore, there's not much we can offer in terms of sure medication to improve sperm quality. Quite obviously, there are changes that we can recommend. You'll understand that the brain releases a couple of hormones to work on the testes to make these sperms. Now these sperms are made in the testes for next 2 months, and then they come out through a fine pipe into the outside when the ejaculation happens. So the sperm quality could be affected if the brain is not producing hormones in the right amount. Now this can be addressed with medication from the outside, because that's something that's possible. If the testes are not functioning properly because of the man working in a heated environment, wearing tight undergarments, taking hot water bath on a frequent basis, or generally being in a heated environment most of the time, then that can be changed if he changes his lifestyle, and that might improve the sperm quality a little bit. We do an ultrasound sometimes and see whether the testes is surrounded by water, which is known as hydrocele, or there is a dilated vein close to the testes, which is a varicocele. If you correct that, that might improve the sperm quality as well. Sometimes the men suffering from poor sperm quality also have coincidental diseases like diabetes, hypothyroidism, obesity. When we correct that, there is a concurrent improvement in the sperm quality. But the sperm manufacturing happens due to some signals which are not well understood by us, and therefore by and large the sperm manufacturing is a process unknown to us, and therefore we can't have medicines just as we have a medicine for malaria or for some other diseases which can just go and improve the sperm quality. Many times we put our patients on a cocktail of antioxidants and vitamins hoping that that will work, but in most cases medicines just do not work, and we have to make do with whatever sperms we have, whether it's for an IUI or an IVF or an ICSI. The good news is, because sperms are so many in quantity, so much in number, so luckily only one good sperm is what you need for a pregnancy, and somebody with the worst of semen samples also would usually have that 1 or 2 healthy sperms that can be used to get him a child of his desire. Sperm freezing is a process by which the person ejaculates and gives us a sample. We can actually take out the sperms from that semen sample and freeze it in a media which can be kept forever. What we do is that the sperms are frozen at minus 196 degrees Celsius in a straw or in a vial and kept as such in liquid nitrogen, and then can be thawed back or brought back to life whenever we want to use it. And most of these sperms can then be brought back to life and can be used for an IUI or intrauterine insemination or an IVF or an in vitro fertilization to achieve a pregnancy. Who needs a semen freezing or a sperm freezing? By and large, this is an option that we offer to cancer patients. Patients who will undergo treatment for cancer. Because most of the cancer treatments even today requires either radiotherapy or high dose chemotherapy medicines. These may damage the testes forever. So as a result, the sperm manufacturing may get completely hampered. So prior to going to such radiotherapy or chemotherapy processes, if we can take the semen sample and freeze it in straws, that person can survive the cancer treatment, come back and have a child of his own, even if his semen sample has gone bad by that time because of his own damage. He can use the old sample and get himself a child of his own by this method. What are the other options where we can go for a semen freezing? Now, sometimes what happens is the man has been transferred out for economic reasons or for job reasons to some other country, and it's not possible for him to come back. Somebody working in the army or military, or somebody who is employed in the Middle East or other places, they find it quite often difficult to come back to the hometown at very frequent intervals. As a result of which they cannot stay together. The husband and wife find it difficult to stay together for long times to father a child. In those circumstances, we can freeze the semen sample and the wife can come to us for insemination, to be injected with his sample at the right time so that they can conceive with the husband's semen sample, even if technically the husband is not around. So this is another indication where a semen freezing is recommended and can be carried out. Third indication of doing semen freezing is when we are actually doing an IUI or an IVF treatment. What happens many a times, the man is unable to give a semen sample on demand. the stress of giving a semen sample, what if I fail, that might make some men nervous and they are not able to give a semen sample on the day of IUI or on the day of ICSI when the sperms are actually needed. If there is a fear of those kinds, what we do sometimes is we take the semen sample on any day prior to the actual treatment, freeze it, so the man is assured that whenever his sample is required, we have one sample frozen from him. If that day he fails to give a sample on a fresh note, then we can always use the frozen sample. These, I would say, are the larger indications why semen needs to be frozen. Other than that, freezing semen because later on they might require it because the age might have deteriorated the sperm sample is not so much of an indication, because men, while they do have worsening of semen over time, the worsening of semen is so gradual or so little that it does not really require freezing of semen sample to take advantage of this loss in vitality because of age. Masturbation is a natural human urge. There are a lot of myths or stories that are built around masturbation. In fact, there are so many people who so-called practicing sexual medicine have made a career out of frightening people into believing that masturbation is unhealthy and evil and so on and so forth. Please do understand that masturbation is completely normal, and in fact it is healthy if it is practiced in moderation. Anybody who is used to masturbating can do so. He just needs to make sure that he is not doing it too frequently or is not doing it too vigorously. Ejaculation, if it is carried out at frequent intervals, is actually good for sperm quality and sperm manufacturing both. It has absolutely no bad effect on either the testes or on the penis or on the person's psyche. Unfortunately, there are certain people who get addicted to masturbation, which is not the right thing to happen, because there are other methods of sexual pleasure, the more natural method or more conventional method of sexual pleasure being one of them. So that is something that needs to be corrected with counseling and with therapy at the appropriate level. But by and large, masturbation, whether it's for the man or for the woman, is a completely healthy, pleasurable activity and completely natural and normal, and we should not take any guilt out of this activity. Poor egg quality is a big reason why people fail to give birth or get pregnant. Now, as we understand, women are born with a fixed number of eggs. Men, on the other hand, keep making sperm till late in their lives. We assume that something like 400,000 or 4 lakh eggs are there present in both the ovaries at the time of puberty for most women. And then they use up 30 of these eggs on a daily basis. Once all of these eggs are exhausted, her menopause starts, or she's finished her eggs and she has entered menopause, and technically she cannot get pregnant ever again. So there is a fertility period for women, something that starts from the time of menarche, which is when her menses start, maybe around 12 or 13 years, until the time of menopause, which is something around 48, 49 years. So this is her fertile period where her eggs are there, and those eggs are causing her to menstruate on a monthly basis. But again, during this fertile period, there are the first few years, that is from menarche till the maybe age of 16, 17, and then towards the end of her menstrual life, that's maybe 42, 43 to 48 onwards, while she still may be menstruating, the eggs that she is using up to grow up every month, the quality is not so good, and therefore these years also her chances of pregnancy are lower. So there is this concept that eggs alone do not qualify you for a pregnancy. They have to be of good health. By good health we mean it has to be genetically and functionally healthy. Not all eggs are genetically and functionally healthy. That's proved. We have done biopsies on these eggs and have found out so. Very few, in fact, of these eggs are genetically and functionally healthy. In some women, they have a higher proportion of healthy eggs and therefore they are more fertile. In other women, they have less proportion of healthy eggs and therefore they are not so fertile. This is one of the major reasons of fertility problem or not getting pregnant in today's scenario. Now, quite obviously, as we understand that eggs decrease in number as the age increases, the quality of oocyte also has kind of a linear correlation with the age of the woman. because it seems that the eggs that are used up in the initial part of her life are of better quality than the eggs that are used up in the later part of her life. So somebody who is in her late 30s or early 40s, and this is not a general statement but mostly observed, have poorer quality oocytes than somebody who is in her early 20s or maybe mid 20s. So that's why we keep saying that age is of a big value or big concern for women to get pregnant, because the oocyte quality is much better in younger women. That is not to say that no woman in the 40s or in late 30s can ever get pregnant. Some of these women have excellent eggs even in their mid 40s. But by and large, age is the single biggest criteria which affects egg quality, and therefore younger you are, better is the chance of your eggs being of good quality. Lady who's wanting to get pregnant, women, they have cyclical activity called menstruation. Now menstruation happens when the body grows one egg every month in 14 days, and then that egg keeps on secreting a few hormones which prepares the endometrium lining, and then when the egg does not get fertilized, it does not yield in the pregnancy, then that endometrium lining that had prepared in anticipation of that embryo settling down to form a pregnancy gets shed off. So menstruation is a monthly activity. It happens because of the egg growing up in the system, and that is a good indicator of good quality oocytes or bad quality oocytes. A woman who is producing poor quality oocytes usually has a challenge in being able to select the eggs every month at the proper time interval, and those eggs do not secrete the hormones also in proper quantities. As a result of which, the menstrual cycle in these women are quite often affected. They could have short cycles or very long cycles, or their flow may not be adequate or could be excessive in amount. So all these are a reasonable indicator about the egg quality, which is basically to be correlated with other results such as the ultrasound findings, the hormonal tests, etc. But by and large, somebody with regular cycles can be expected to have better quality oocytes than somebody who has irregular, delayed or otherwise disturbed menstrual cycles. Quality of gametes, be it the sperm or be it the egg, is very difficult to predict from outside. It is only when you collect the eggs from the ovaries of the woman while doing an IVF, or when you collect the sperms and when you put them together under the microscope, that is when for the first time when you look at the eggs, you have a fair idea whether the egg quality is not optimum or less than optimum. Many times the menstrual cycle of the person may be deranged, and that may give you an indication, but the final diagnosis or confirmation will only come when you look at the eggs under the microscope. Sometimes even that is not good enough. They might look absolutely healthy, and when you do a genetic test on them, that's when we find out that the eggs are not of good quality. So per se, detecting the quality of either the egg and the sperm is a very tricky job, and if something is so tricky, it cannot be treated that well as well. We feel that the quality of the oocyte or quality of the sperm is an overall indicator of the health of the person. And if the health of the person is compromised for diabetes or low thyroid status or obesity or some such problem affecting her hormonal status, that might affect the egg quality, and this can easily be corrected by correcting the underlying condition. But if the reason for poor egg quality is age, or something like the genetics of that person concerned, then by and large this is not treatable, not correctable, and we have to learn to live with it or manage with what it is rather than try and treat it. As such, the treatment that we offer to our women, if the oocyte quality is suspected not to be good or not to be healthy, is we put them on antioxidants, put them on a healthy lifestyle, try and ask them to achieve the normal BMI, the body mass index, so that we can expect that whatever be the underlying hormonal issues, if they have been corrected, the oocyte quality can correct itself to a large extent. But if the background is genetics, or the background is something else that we don't even know what's the reason for poor oocyte quality, unfortunately we cannot correct it. In extreme situations, we'll have to go for either egg donation or embryo donation to get these ladies pregnant. Egg freezing is a modern method by which the eggs of the woman are extracted and can be frozen in liquid nitrogen and kept in that situation forever. Why has it become popular these days? Now we have to understand that over the last 100 years, the age of the woman who is getting pregnant is shifted by almost 10 years. So if it was in the early 20s, 100 years back, it is now late 20s or early 30s that women are now taking a pregnancy. There are a lot of reasons for that. They're getting married later, they're studying for longer time, they're all pursuing a career or they're working elsewhere, and sometimes they just don't want to have a child because they're enjoying life. Now all this is fine, and I think women have a right to this. The problem that happens is women have a biological clock ticking. Remember, they have a fixed number of eggs and these eggs are exhausted over time. So a younger woman would always have more eggs and therefore a higher chance of getting a child. Now if somebody wants to delay motherhood or getting pregnant to a later age for whatever reason, that's perfectly understandable. But a body does not respond later on and may not produce good eggs when she's actually ready for a child. In such situations, it is recommended that she goes for what we call social egg freezing, which is she doesn't have a medical reason for freezing her eggs, but she is doing it for social reasons because she is not prepared to have a child just yet. She undergoes what is a standard IVF procedure. She takes stimulatory medications. The eggs are grown up. Sometimes 10 or 12 eggs can grow up together. Those eggs are then extracted of her body through a needle, through a process known as oocyte retrieval. These eggs can then be stored for her to be used whenever she wants. This is a highly effective technique and has been recommended in many societies by many companies as well as a method of ensuring, I would not say ensuring, a method of increasing the chances of having a child later on. We must remember here that the eggs that have been extracted in a particular month or a particular cycle by no means guarantee a child later on. And freezing of oocytes cannot be looked as the best option for motherhood. Trying naturally stays number one. But for some reason, if that's not possible, then one can look at freezing of oocytes. But at least a number I would recommend is at least 14 mature eggs need to be frozen so that you can actually look at a semblance of a chance of having a child with these eggs. 1 or 2 eggs or less number of eggs do not really give you much of a chance, and this should be understood before somebody enters egg freezing for social reasons. The other big indication that's coming up these days is for cancer patients. More and more people are getting diagnosed with cancer and getting treatment at the right time at early stages, which is helping them to survive the cancer and then have a properly normal life later on. Except for the fact that cancer treatment is usually carried out through chemotherapy medicines or through radiotherapy of some sort. And many times these medications or radiotherapy permanently damages the ovaries. So while the person can survive cancer, it so happens that her ovaries are permanently damaged and she is rendered infertile for the rest of her life, and she cannot have a child with her own eggs later on. Now if these women can be encouraged to freeze their eggs prior to starting the cancer treatment, then she can come back and use these eggs after her treatment is over and when she is ready for a child to get a child of her own eggs. This is something I would say is a wonder of modern medicine, and this should definitely be informed or be let known to as many people as possible that this is an option that exists today and is present here in the city as well. Of the reasons for infertility, egg quality, sperm quality or the tubal disease are highly common reasons. Then comes the inability to have sex properly. Extremely rare, or the rarest of all, is a condition where the uterus is not receptive. It is either having fibroids or tumors, or it is too large in size called adenomyosis, or it's congenitally absent or small in size, or has been removed rarely for some operation. When the uterus is absent but everything else is fine, what we do is the eggs of the person and the sperm of the partner are fused to form embryos, and then these embryos are then put back in somebody else's womb, and this is known as the process of surrogacy. The lady who agrees to carry the pregnancy is a surrogate. She is acting as a surrogate for the couple who has commissioned the pregnancy for us. Now, surrogacy is very, very popular in media, literature and culture, but it's not so much required in actual practice. So if there are 10 couples who come to my clinic asking for surrogacy, when we go through their papers and we talk to them and we understand that they had no idea what surrogacy is all about, actually it's only about 1 out of the 10 couples who needs a surrogacy. Rest needed something else, maybe an egg donation or a sperm donation or something else, and they have confused surrogacy with the whole thing. So surrogacy is much more popular in popular culture or in media than in real practice, and this is something that I wanted to mention here. How does the work happen? The lady in question, the one who is not having a child, usually has a reason why her uterus is not healthy, and she knows about the reason. It could be fibroids or adenomyosis or an operation that has removed the uterus, so the uterus is small since birth. These women have functioning ovaries and they are put through injections to grow her eggs, and then those eggs are taken out of the body and fused with the partner's sperms to form embryos. These embryos can then be put back in a properly prepared womb of a surrogate. The surrogate then carries the pregnancy for the next 8 months, and then she undergoes a cesarean section or a natural birth to give the birth to a child that genetically belongs to the first couple. And after birth, this child is given back to the first couple. In lieu of carrying the pregnancy, it's either the surrogate who is a relative of these couple, or she is paid a consideration or a reward because she has carried this pregnancy for them. This is the process of surrogacy. By and large, surrogacy is now under a cloud because there is a law that is pending and that might come in any moment. Once the law comes in and clarity is achieved, then maybe surrogacy again will come into popular practice. But as of now, surrogacy is not being practiced in most clinics. Single parenting or single parents is when a man or woman wants to have his own child without being in a married situation. Technically, this is possible through IVF or IUI, and this is being requested also these days in quite large numbers, but the legal situation in our country is not very clear. As far as the man is concerned, if he donates his sperms, then those sperms can be united with the donor's eggs and embryos can be formed, and those can be then put back in a surrogate's womb. The surrogate can then deliver the child for the man, who genetically, as is clear, is linked to the man. This way he can father a child. This is possible, but as far as the law in our country is concerned, they're not very clear as to whether this can be done or not. There are instances where celebrities have gone ahead and have done so, and it's all celebrated as well in media. People have been largely supportive, and that's a good thing. But we're not very sure whether we can do this on a routine basis to the people who keep seeing us or wanting our opinion on this. We'll have to await legal clearances or clarity from the government on this. Single women wanting to have their own children is something that has been practiced, and I've been a big supporter of these as well. Single women have gone ahead, used their own eggs and donor sperms and gotten themselves pregnant and delivered. By and large, again, the society has been very supportive of such women. They have had to fight their own battles because the situation is not always conducive, whether it's a school admission or getting the filing of the cards and everything else done for them. But they have fought their way, and they are very happy that they've taken this decision. When we choose somebody for a single parenting, we look at the family support that they have, the mental conditioning that they have, whether they're prepared for it, whether they understand the positives and the negatives about single parenting, whether they can survive the challenges, and then we choose them and then we go ahead with this. But as I have mentioned, the legal clarity is awaited by which we can then choose our patients wisely and go ahead and recommend them. One of the advantages of IVF in the last 20-25 years has been the elderly women and elderly men having children. When celebrities have children in their 40s and their 50s, then patients quite naturally ask us, as how is it that they have had children at such late age and you are telling us that our chances are low? Please understand that IVF is a process where eggs and sperms can be combined to form embryos, and then these embryos can be put back in a lady's womb to get her pregnant. As we understand from medical science as of now, it is the lady's eggs that become worse with time, and therefore an elderly woman has poorer quality eggs and a much lesser chance of having a child of her own. But that doesn't prevent her from having a child. Rarely somebody in early 40s can still have good eggs and get pregnant with her own eggs. But mostly the people who are getting pregnant in their early 40s or even after they have hit menopause is not with their own eggs. They are choosing to get a child through donor eggs, which is perfectly legal and a nice way of getting a child of their own. What they choose to do is to choose a donors who will then donate her eggs, and those eggs can then combine with her partner's sperms to form embryos, and then these embryos are put back in their womb. Somehow the womb is a very loyal organ. It does not go bad and can receive a pregnancy and continue a pregnancy pretty much late in the life, even in the early or late 60s. We have had instances where people have delivered in their late 60s as well. I am not a supporter of this. I feel, and that's my personal view please, that women in their late 50s should be spared the trouble of motherhood by this method, because while the pregnancy is possible, the womb can carry the pregnancy, but the toll on the body is pretty high. The women who in their 40s and 50s have much higher chance of developing diabetes or blood pressure during pregnancy. Their heart conditions are much worse, their kidneys are not so strong, the liver is not so strong, so therefore putting them through the rigors of a pregnancy, which is quite a tough job even for somebody in the early 30s, may compromise their health and may make them age much faster than they would otherwise. So personally I have taken a call that women after they have hit 50 are not recommended for any method of pregnancy, even though it is possible easily to get them pregnant through donor oocytes. But yes, if the question is IVF done after menopause? Yes, it's highly possible. All that you need to do is to take donor oocytes. It's highly prevalent, highly popular also. By and large, this is the method by which women in their late age can have their children on their own. They can carry the children, they can give birth, the satisfaction of motherhood is there. But genetically, because the embryo carries somebody else's genes, is not really their own. They're only carrying the children and they're socially getting a child, but not genetically their own.